This is Michigan's retirement coach, Mike Douglas.
Even the talented and wealthy come back. They always come back. Actually, no, I shouldn't say that. We're going to talk about a story about Venus Williams coming back to work, and this is the opposite of what you work to do, Mike. We don't want you to unretire, ever.
No.
This is not the goal of Mike Douglas and the team at Life Plan Financial Design. We want to talk about the things not to do. Although when it comes to the Williams sisters, both Venus and Serena, there are lots of things that we should all strive to be like them in so many ways. So much success, so much athleticism in that family. This is Mike Douglas, certified financial planner and Michigan's retirement coach at Life Plan Financial Design. Mike's business, a local independent financial advisory firm in mid-Michigan and in Grand Rapids. As you are listening to or watching this podcast today, if you've got questions about when it comes to planning for retirement, Mike and his team, they are here to help you get some answers. So visit us at michigansretirementcoach.com or click on the links we got posted in the show notes. You're an athletic person, but I feel like you kind of do a lot of endurance stuff. You run a lot and you hike a lot. You do a lot of mountain climbing. Have we ever, I don't even know, do you play golf or tennis or any of these things?
I played tennis in college.
You did? That's right. I
played at Adrian College. Yeah, in Adrian, Michigan.
Yeah, that's right.
Division III school. I was there. I played tennis for 2 years.
Got it. Then what happened?
Got married. Got a job.
Had 4 children. Started running a business. Turned 41.
Yeah.
Welcome to adulting.
And here we are. Yeah.
Okay.
Yeah. So when I saw this story, I obviously a huge tennis person my whole life. So any time I get a chance to talk about it, I like to do it.
Okay. Let's talk about it then. Venus Williams, older sister of Serena. She has been away from professional tennis for about a year and a half. She's back, however, though. The 45-year-old is apparently trying to earn a pass into the U.S. Open, but there's another reason for her return. Here's what Venus herself said.
I had to come back for the insurance because they informed me earlier this year I'm on Cobra. So I was like, I got to get my benefits on. Started training. Insurance, you guys know what it's like. And let me tell you, I'm always at the doctor. So I need this insurance.
She speaks to so many of us. There's something that happens past the age of 40 and the specialists that come in, I feel like I have a doctor's appointment. I'm either planning a doctor's appointment or attending a doctor's appointment at least once a month. And I'm only 45 years old. My mom would probably roll her eyes at me at this phase of my life. So let's talk about the correlation, the relating that we can feel with Venus, because it's estimated that a 65-year-old couple retiring today, Mike, they can expect to pay an average of around $350,000 for their health care. That includes Medicare premiums, deductibles, prescriptions, and other out-of-pocket costs, but that does not include long-term care if they do need it. So when it comes to medical costs, are they becoming a bigger line item in the plans that you're building? How are you planning for it? How do you figure that out?
Yeah, I think that there's a lot of people who, as they go through their plan, medical, and I know we're kind of joked about this before the podcast, the lawn mowing guy is right by the yard.
Right by the window. If you hear him buzz by.
We're regular people with a regular business getting our regular lawn mowed. And no matter how much money you put into a podcast studio, you can't stop the lawnmower from mowing the lawn.
He sure showed up right before we started to record.
Right as we started. That's all right.
Yeah.
But in retirement planning, there is a line that gets often overlooked, and it's the overall cost of healthcare.
Okay.
We hear the horror stories of long-term care.
Yep.
And that's when people say, well, it's going to cost me hundreds of thousands of dollars. But yet your Medicare premiums and all of the adjoining costs to it will also run the bill up quite a bit.
Yep.
If you think about it this way, if you live 25 years of retirement, $350,000 divided by 25 years is about $14,000 a year. And that's very possible once you factor in premiums, supplemental coverage, co-pays, prescriptions. And if you have a major health event, it can spike quickly. We had a client, a couple, Bill and Linda. He was 66, she's 64. They had a strong portfolio, decent pension, but they hadn't factored healthcare into their budget. They just assumed Medicare and supplements would be cheap and would work. within 18 months of retirement, Linda needed a knee replacement and Bill had a minor heart procedure, not major, minor heart procedure.
Okay.
And like you were saying, the doctor's appointments keep coming and keep coming. And Venus says she's at the doctor's all the time. When you're in your 60s, it's even more. And between premiums, deductibles, copays, they spent $21,000 in those first 2 years alone.
Jeez.
Yep. So, and that wasn't catastrophic,
right?
But it did mean they had to adjust some travel plans and dip into savings more than they wanted to.
Okay.
So when we sat down and rebuilt their plan, this is the story they came in as they're talking to us when they came in and meet with us. That's what they had just been through. So we rebuilt their plan. We added a healthcare bucket that could cover projected costs for the next 25 years. Now they have a dedicated strategy. It's not blindsided by medical bills. And you know what? They told me the biggest relief wasn't the money. It was knowing that they could say yes to the other things in life without worrying about how it would affect their health care. They could now know, well, my health care is taken care of. So now if we want to build that, that cruise, if we want to go snowbird or do whatever, it's not affecting their health care. So there's a lot of peace of mind that comes from planning that out and understanding that health care is a big ticket thing. Healthcare inflation is real.
Yep.
For the last 20 years, medical costs have risen faster than overall inflation almost every single year. So as we keep hearing about regular inflation, medical inflation is worse. So we want to make sure we're building that in prescription drug prices, procedures, even basic medical services. They all cost more.
Yep.
So it's a big thing to factor in.
Yeah. Something that you and I have talked about. I think we've talked about it off camera, maybe even on camera too. The idea of hotels and hospitals. How do they make their money? They make it when beds are full.
Full beds.
And unfortunately, it's almost kind of, the other thing we've talked about is how the financial services industry is not built for us as consumers and savers. It's built for the financial services industry. Yeah. You do get to the point where you kind of feel the same about the medical services industry. Listen to me. I am a firm believer in modern science. Don't hear what I'm not saying. I love our doctors and nurses. I'm so grateful for the medical care that I've had in my life. I don't know. Honestly, I've had to have a lot of medical care in my life, and I'm very, very grateful for it. However, it does feel a little bit like you're having to fight an uphill fight when it comes to your medical care. And I remember my mom, when she retired, when she hit retirement age, filing for Medicare, she said to me, she paused because she had these two huge binders. My mom is from New York. She had a job on Wall Street as a certified as a licensed trader. And she looked at me and she was like, I'm having a hard time figuring this stuff out. What does somebody who has less affluence or less education do? Like, she had genuine concern for so many people.
Yeah. It's crazy. And I think that especially, and I'm glad you brought the medical professionals piece, because we have so many of them. Like, my mom's been in nursing my whole life.
Yep.
And whenever you meet them, most of them say they love the care. They love the patients. They do not like the bureaucracy and all the red tape.
And that's getting worse. That's getting worse and more stressful for Medicare, for medical professionals.
And we do have a busted system.
Yep.
I mean, we have a system where sometimes, and I hate this. I absolutely hate this about our system. But there's times when it can make sense to get a divorce to qualify for Medicaid quicker to cover long-term care costs. Mm-hmm. That's garbage.
How
we shouldn't live in a society
up is
where
that?
that's a good thing.
Yeah.
Yeah. And it's tough. Now, we work very closely with estate planning attorneys and understanding the latest opportunities and what can be done with spousal trusts or different things. But if you understand the fact that the system is not built for you, it's built for the system and it's built for the masses, then you need to start line iteming and plan, because it's not new. Like, this is not a new thing,
right? That
medical stuff's expensive.
Right.
It is not new that it's one of the highest expenses you'll have in retirement. None of this is new. But yet, over and over again, when I say, what are the biggest concerns in retirement, people say taxes and income and risk, which are all really good things. We have to deal with all those things. And they never talk about the monthly cost of healthcare. They do talk about long-term care and what happens in the nursing home. But this $350,000 albatross that's there that nobody wants to discuss because it's, well, I'll just get on Medicare. Medicare needs to be planned in. Your prescriptions, all the stuff needs to be planned in. And to just lump it in and say, well, if the market does, if we take 4% out of our portfolio every single year, then the money should last 30 years. But if you do that, and then a major medical thing causes a high cost, now you get less other money to live off of. you don't get to take the cruise, not because you did anything wrong, but because you had a major medical, again, and I say major, if you have a knee replacement, your life's not in danger,
right?
But it's a cost and you have to go through recovery. So then when you finally get to go, you want to go do something.
Yep.
And, the rest of your body's really healthy. Your knee just needed some work.
Mm-hmm.
And so then you finally want to go and do some traveling, but you can't because the cost of the procedures took away your travel
budget. Yep. Mm-hmm.
And so that's why we want to be very careful and make sure that we are planning a plan that makes sense for you and not for the financial industry. It is not for the insurance companies. It's not for the medical industry. We love our doctors. We love our nurses. We love our people who serve and give their lives to helping other people get better.
Yep.
But it all comes at a cost, and we have to plan for that.
Yeah. All right. Action items for people that are listening to and are watching this podcast then, because you've got 4 points here that you want to make sure people are covering.
Yeah, absolutely. Number one, know your numbers.
Okay.
Use realistic estimates based on your age, health history, and retirement timeline. And I say this in all sincerity.
Yeah.
Go on to ChatGPT and just type in your information and say, what does it look like my expenses will be over the next 35 years?
When you say like numbers and like, what do you type in? Just be like, I am 65 years old. I am a man. I have had no heart conditions, but I have high cholesterol. I'm 6 feet tall. I weigh 200 pounds, that kind of stuff.
Yeah. And then say, what would my estimated health costs be over the rest of my life?
Okay.
If you don't want to do it that way, we can do it. We have the calculators. We have the formulas. We know how that works.
You have software to help with stuff like this, right?
Oh, yeah. Yep. And so know your numbers is number one. Number two, consider insurance strategies. Look at the Medicare options, supplemental plans, even HSAs if you're still working. If you are within a couple of years of retirement, and we always talk about loading your retirement accounts, you may want to load your HSA account.
Okay.
You can put money in this health savings account. It goes in tax deferred. If you use it for healthcare costs, it comes out tax free. And so it becomes a really good benefit there.
Does that money get stuck?
A whole lot of stuff.
What if you save a lot of money to your HSA and you don't use it? What happens?
It becomes like a regular retirement account. It turns into an IRA if you don't use it for health savings. But again, you can use it over the course of your life.
Okay. Got it.
So there's a lot of stuff there.
Okay.
Number three, budget for out-of-pocket costs. Right. So in your budget, if you know, well, gosh, you have glasses or you have hearing aids or you have whatever else, and you need to build that in the budget. Mm-hmm. Prescriptions, dental, vision, hearing, none of which are fully covered by Medicare. Mm-hmm. So don't let it catch you off guard. Build a plan for it. And then finally, number four, don't forget long-term care. Even though it's not part of that $350,000 number we talked about, it can be a big expense when it comes time.
Yeah.
Now, depending on where you are in terms of assets, there are different strategies for dealing with long-term care, but having a discussion and understanding that there is no perfect long-term care investment. Right. If they say it is, it's not.
Okay.
At some point, the rug will get pulled out.
Okay.
So we just want to make sure that we're aware, educated, and making good decisions.
I've heard about life policies that have long-term care riders.
Yep.
And that if you don't use it, it could be a death benefit.
Yeah, I lean towards that type of an investment, something that says, all right, if I never use it, my family gets a death benefit out of it.
Yeah.
I don't like the ones where it's, it's really cheap at age 60. It will get more expensive in your 70s. And if you never use it, you get nothing back out of it. You paid for someone else's benefit. Because with those, typically about the time you would need it, the premiums get insanely expensive and you don't pay it anymore.
Yeah.
And you just fund it into someone else's benefit. Yeah. I'd rather have something that I put money into, and over the years, if I need it, it's there for me. If I don't, then it goes to my kids or my wife, and that's a better solution.
Got it. You and I have a mutual friend, Abe. He always likes to say, your health is your wealth. That is something he really wants people to think about and know about. I know you're such like an endurance athlete. You have such a priority for health, you and your family as well. So I know it's very important for you. And it's important for you listening to this podcast. Mike wants to prioritize your health and make sure that you have factored in what's necessary for your retirement plan. So if you have questions about that, if you're not really sure where to begin when it comes to figuring out medical costs, factoring those into your retirement plan, MichigansRetirementCoach.com is our website. You can go there, click on that Start Your Retirement Roadmap button to begin the conversation with Mike and his team. We also have links posted in the show notes, so you can just click there. Your health is your wealth. Let's factor it into your plan. Visit us at MichigansRetirementCoach.com.
Thanks for listening to Michigan's Retirement Coach with Mike Douglas. To learn more, visit MichigansRetirementCoach.com.
Michael Douglas is an investment advisor representative of Stewards Wealth Planning, LLC, a registered investment advisor. Financial professionals are not licensed in all 50 states. To find out if Michael Douglas is licensed in your state, please call 517-323-7526. Stewards Wealth Planning, LLC is not affiliated with nor endorsed by the Social Security Administration or any other government agency and does not provide legal or tax advice. Annuity guarantees rely solely on the financial strength and claims-paying ability of the issuing insurance company. By contacting us, you may be provided with information about insurance and annuity products offered through Michael B. Douglas, NPN number 9650939.